This is your News Source Evening Bulletin for today, Thursday, the 6th day of January in the year 2022. I'm Gordon Mosley. Here's what we're tracking tonight. As Guyanese are being encouraged to double up on their precautions against COVID-19, the virus continues to surge, with the Minister of Health revealing this morning that in the past 24 hours, the country has recorded 967 new cases of COVID-19. That number eclipses the country's previous record for the number of new cases in a day, which was set just yesterday. The total number of active cases in the country now stands at 3,481, but only 70 persons are hospitalized across the country, with 6 of them requiring intensive care.
As we have estimated with Omicron that we would get an increase in cases. And so over the last 24 hours, we have had 967 new cases. From about 3,226 tests that were done over the last 24 hours. That would mean now that we have 3,481 active cases.
Region 4, which is the home of the nation's capital and largest population spread, continues to see the highest number of new cases. The number of active cases in Region 4 has been pushed to 2,289.
In Region 1, currently we have 14 cases. In Region 2, 58 active cases. Region 3, 285 active cases. Region 4, 2,289 active cases. Region 5, 83. Region 6, 374 cases. Region 7, 110. Region 8, they're showing 1 case. However, that is because they haven't been doing a lot of testing, and I guess because of the geographical terrain that they haven't been able to do a lot of testing. So their numbers remain artificially low because I'm sure they have cases up there. Region 9, we have now 160 cases, and Region 10, they have 107 cases.
The Minister of Health, Dr. Frank Anthony, has admitted that while tests to determine the Omicron presence in Guyana are still to be completed, based on all the evidence being presented in the past 3 days, it is clear that the faster spreading variant has been present in Guyana for weeks.
All these people who have tested positive, we are asking them to stay in isolation, because there are people who have tested positive and sometimes they still walk around the place, which means that they would be in their infectious period and they would be the persons who would be spreading it to others. So if you have been diagnosed as being positive, then you should stay home and be in isolation so as to prevent or reduce the spread of Omicron. If people don't behave responsibly, we are going to see more cases.
Dr. Anthony has assured that the Ministry of Health is prepared to address the situation, although many of its own staffers have been forced to take time off from their jobs after testing positive for COVID-19. Unvaccinated persons are at a higher risk of suffering severe illness from the new variant, and they are being encouraged to get vaccinated soon. More news coming up in just a moment.
What is fiber? Think exceptional. GTT Fiber is an advanced high-speed internet product that delivers broadband via fiber optic cables with download speeds of up to 150 megabits per second. It means your internet is faster, and GTT Fiber comes with the added coverage of our Plume HomePass Wi-Fi system. Plume extends your Wi-Fi signal to ensure that you have the best experience in every corner of your home with Wi-Fi everywhere. Upgrade to GTT Fiber today and don't get left behind tomorrow.
It's one of your biggest goals, getting your own home, where memories are made, where happiness lives. You may feel that home ownership or renovation is beyond your reach, but we at Republic want you to know that there's always a way. Ask us about our suite of mortgages. Let's help make your housing wishes come true. Or advise on how the equity in your existing home can finance other dreams and goals. Call or go online to learn more.
Will you be there when we come to play? Will you be there to see our stars shine? Will you be there 24
www.u19cwc.com/tickets.
Will you be there?
You see them children playing in the dirty water again?
You know me talk to them this morning, like them don't understand.
Every time it flood, they just want to go in the flood waters. They think this thing is fun. You could get serious diseases in the water. And if an electrical line fall in the water, you could get electrocuted. Little boy, you want to tell you not to play in that water? Come here this minute.
You see the water don't start coming in the house? When you're living in a downstairs, you just got to take precautions.
That is right. You got to make sure there's a pair of long boots for every member of the family. Protect drinking water from contamination. Keep a stock of foods that can't spoil. And have some place to go if your place flood out.
Guyana, our country, our responsibility.
We've got exciting news! All 12-ounce yellow cab Buster are now only $100. Buster, live in
Come
full
get
color.
your Buster, Buster $100. Come get your Buster, Buster $100.
Welcome back. Opposition members of parliament today again called out the government for its handling of the COVID-19 pandemic, but more particularly its decision to reopen schools when the virus spread is surging. During a press conference today, opposition members of parliament Dr. Karen Cummings, Dr. Nicolette Henry and Ganesh Mahipal opined that the government's decision to reopen schools and its plan to leave schools open amid the surge in cases is very worrying. According to Member of Parliament Nicolette Henry, while the Education Ministry has been banking on UNICEF's call for the reopening of schools due to learning loss, it has not been following the very recommendations put forward by UNICEF for the safe reopening of schools.
Insofar as the reopening of schools is concerned, we are dissatisfied with the lack of preparedness and what appears to be a disorganized approach, specifically to the reopening of our schools.
And Member of Parliament and former Junior Health Minister Dr. Karen Cummings in her contribution stated that the Education Ministry should have crafted a plan with specific undertakings for students to return to school. She said such a plan would prevent a recurrence of what took place last September, when schools were forced to close their doors because of COVID-19 cases.
The APNU-AFC coalition recommends that the Ministries of Health and Education map out a clear path to avoid confusion among teachers and students who would have been evaluated positive for the virus, meaning that such samples should have been given high priority for genomic sequencing at a sister CARICOM laboratory where the testing for Omicron or the Delta virus are done, so that one could ascertain whether the teacher could return to school, like if it's Omicron, 5 days after symptoms, or in the case of Delta virus, 10 days.
Opposition Member of Parliament Ganesh Mahipal stressed that enough consultations were not done prior to the reopening of schools, and that approach is now causing problems within the school system, since stakeholders now have to turn to the Education Ministry for answers, and in many cases, those answers are not provided.
What really is being done about the alarming amount of teachers that are tested positive, and what is being put in place, and to also call on the Ministry of Education on behalf of the APNU-AFC, the coalition opposition in the parliament, to release the data, provide us with the number of teachers that are currently positive, and state whether they are isolated at home or elsewhere.
Mahipal said the Ministry of Education should also provide the data on the number of students that have tested positive for the virus since the reopening of schools on Monday, and what systems will be put in place to cater for them. In a statement yesterday, the Guyana Teachers Union called for a suspension of face-to-face classes after it discovered that more than 65 teachers and 40 students at various schools have tested positive for COVID-19 in recent days. The government has indicated that it has no plans to shut schools down again. A 35-year-old woman and her 6-year-old daughter lost their lives after their small wooden house collapsed, pinning them under the rubble. The incident took place yesterday afternoon in Lower Bonasika Creek in Essequibo. The dead woman has been identified as Simati Chandra, who worked as a farmer in the area. Her daughter's name has been given as Christine Sugtiyo. A police report said the mother and daughter were under the house feeding their puppies when the entire building collapsed on them. The woman's husband said he was at a nearby farm clearing land when he received the news that his house had collapsed. The man said when he rushed back to the home, he found his wife and daughter pinned under the house. With the help of other villagers, the two bodies were pulled from under the house and transported by boat to Parika, then to the Lenora Hospital, where doctors pronounced both mother and daughter dead on arrival. A full investigation is underway. The Ministry of Health today announced the appointment of Ministerial Advisor on Health, Dr. Leslie Ramsamy, as the new chairman of the Georgetown Public Hospital. He has replaced Dr. Madan Rambaran. In its statement announcing the appointment of the new board of directors, it was also revealed that Robbie Rambaran is the new chief executive officer at the hospital. He previously served as the deputy CEO and has been acting in the position since the contract for the last CEO was not renewed. Minister of Health Dr. Frank Anthony met with the new board members today to outline the government's vision for the Georgetown Hospital and the planned improvements that are in store for the facility. The Georgetown Hospital is Guyana's premier and largest medical institution. It is currently facing some staffing issues as a number of staff members, including doctors and nurses, have tested positive for COVID-19 and have been forced to stay at home. Let's tell you now that officials of the Guyana Power and Light Company and union representatives from NASI met today with the Chief Labour Officer as attempts begin to reach a settlement for salary increases for GPL workers. The power company has been complaining that its current financial situation does not allow any increases to be granted, but the union has been insisting that workers ought to be paid the same 7% salary increase that was given to public servants.
At this point in time, we were asking for 7%. We hope that we can get to 7% with the meeting that is going to happen on the 13th.
Union Representative Donald McFarlane. The union has been pushing the company to meet and finalize salary increases, but the meetings were not convened, resulting in the intervention of the Labour Ministry.
But we hear from the company and its senior managers that they have to first have an undertaking from the board. So we hope before the 13th, the board of directors of GPL would consider what their senior managers and CEO and deputy CEO is put forward to them so that they can come and tell us something that is going to be favorable.
The power company has indicated that over the years it has encountered losses to the tune of $5 billion due to line losses and other factors. But the workers have insisted that they cannot be blamed for those problems and ought to be paid the increases. An early morning fire gutted an empty house in Prashad Nagar and scorched two other nearby houses. The fire service said it was summoned to the blaze at 91 Prashad Nagar at around 3 o'clock this morning. When they got there, the two-story wooden and concrete house was already completely engulfed in flames. The building and all of its contents were destroyed. The two nearby houses, which were also scorched, were also unoccupied. A cause of the fire is still to be determined. The fire service is encouraging persons to install fire detectors and extinguishers in their homes.
Sonia, you think people easy? People just really want to do their own thing. Look across the road how we building the house low. The building code say you're supposed to be 2 feet off the ground.
And when the place flood, them just be the first to complain.
But you know sometimes we that just contribute to the flooding with we behavior.
You know, boy, we just throw things in the drains and canals. We don't keep the gutters clean and dispose of garbage properly. By the way, you got an emergency kit?
Yeah, Sonia, I got me own and it got drinking water, army medicines, and first aid things like band-aids, iodine, bandages.
And me own got in toothpaste, a change of underwear and clothing, toilet paper and soap.
Guyana, our country, our responsibility.
It's one of your biggest goals, getting your own home, where memories are made, where happiness lives. You may feel that home ownership or renovation is beyond your reach, but we at Republic want you to know that there's always a way. Ask us about our suite of mortgages. Let's help make your housing wishes come true. Or advise on how the equity in your existing home can finance other dreams and goals. Call or go online to learn more.
We've got exciting news! All 12-ounce yellow cab Buster are now only $100. Buster, live in
Come
full
get
color.
your Buster, Buster $100. Come get your Buster, Buster $100.
How fast is fiber? Think fast. GTT Fiber has 3 packages with download speeds of 50, 100, and 150 megabits per second. That's fast enough to stream movies and music, to chat with Gran and Fran, to study, and more. What would you do? Upgrade to GTT Fiber today and don't get left behind tomorrow.
Fuel it up and drive, Super 95. Tune up. Fuel it up and drive, Super 95. Tune up. Protect your fuel system, boy. High mileage and performance, boy.
Guy Super 95 gasoline gives you more reasons to drive and is available at 56 service stations nationwide. For affordable price, high performance, and high mileage, choose Guy Super 95 gasoline.
Fuel it up and drive.
Across the region tonight, scores of nurses in Barbados marched through the capital of Birchtown today to pressure the government to address their long-standing grievances. The nurses have been on strike for several days. During today's protest, the nurses chanted loudly, and they were led by the leader of the Unity Workers Union, Caswell Franklin, who told reporters that it was a good day for the nurses and a good day for the march. He said the protest did not break any COVID rules. He said persons are crying out for help and persons are crying out for assistance from the Barbadian government, especially the nurses. The nurses are pressing the Barbadian government to address concerns, including the need for better working conditions and increased pay, health insurance, improved nurse-to-patient ratios, and remuneration for degrees and continuous training. In Jamaica, there are concerns in the medical community about the accuracy of COVID-19 tests being conducted by private facilities, as well as suggestions that false negatives are being arrived at because of poor technique. The issue came to the fore on Wednesday, but the Minister of Health and Wellness, Dr. Christopher Tufton, has indicated that the problem is not as grave as is being portrayed. One medical doctor has claimed that the issue is causing chaos, referencing the practice of merely tickling the nostril, especially when administering an antigen test. Antigen tests are predominantly being administered by private facilities in Jamaica. The accuracy of antigen tests in general is varied and is less precise than the PCR test, which is regarded as the gold standard. Some studies indicate that the accuracy of antigen tests could be as low as 60% when self-administered. And finally tonight, international news. Kazakhstan's government is restoring vehicle fuel price caps for 6 months after days of deadly unrest. Petrol and diesel prices will also be capped for the same period. The price for liquefied petroleum gas, a common car fuel in Central Asia, doubled when the limit was removed this week. It comes after protesters took to the streets in several cities. Though originally sparked by the fuel rise, the protests quickly broadened to include other political grievances. Kazakhstan is often described as authoritarian, and most elections are won by the ruling party, with nearly 100% of the vote. There is no effective political opposition in the country. And that's your News Source Evening Bulletin for tonight. I'm Gordon Mosley, reporting and encouraging you to stay safe.